Eczema is a common skin condition that is known for its itchy and inflamed patches of skin. It is also known as atopic dermatitis. It is more common in babies and young children. It occurs on the faces of infants as well as inside the elbows and behind the knees of children, teenagers, and adults. It is caused by an overactive immune system. Up to 20% of children and 1 to 3% of adults develop atopic dermatitis. It affects both males and females equally. When people refer to eczema, they usually mean atopic dermatitis, which is the most common and chronic type of eczema. Other forms of eczema include contact dermatitis, which is caused by coming in contact with irritants, and nummular dermatitis, which causes dry, round patches of skin in the wintry months. An eczema flare-up is when one or more eczema symptoms appear on the skin. The cause of eczema is not fully understood. Eczema is thought to be triggered by an overactive immune system that responds aggressively to the presence of irritants. Eczema is sometimes caused in part by an abnormal response to proteins that are part of the body. Normally, the immune system ignores proteins that are part of the human body and attacks only proteins of invaders, such as bacteria or viruses. In eczema, the immune system loses the ability to distinguish between the two, which causes inflammation. Common triggers of eczema flare-ups include chemicals found in cleaners and detergents that dry out the skin, rough starchy material like wool, and sweating. The main symptoms of eczema are itchy, dry, rough, flaky, inflamed, and irritated skin. Areas of skin can flare up, subside, and then flare up again. Red or brownish-gray patches are common symptoms. Small raised bumps that ooze fluid when scratched are another symptom. Eczema can cause intense itching. Scratching further irritates and inflames the skin. This can cause infections that must be treated with antibiotics. To diagnose eczema, a physician will order a complete physical exam and ask questions about symptoms. While no specific tests can diagnose eczema, a patch test can pinpoint certain allergens that trigger symptoms, such as skin allergies associated with contact dermatitis. During a patch test, an allergen is applied to the patch that is then placed on the skin. If you are allergic to that allergen, your skin will become inflamed and irritated. A dermatologist, allergist, or primary care physician can help you identify the correct treatment for your eczema. Oral, over-the-counter antihistamines may relieve itching. They work by blocking histamine, which triggers allergic reactions. Some common antihistamines include Zyrtex, Benadryl, and Claritin. Cortisone cream can relieve itching and scaling as well. It should not be used long-term, though, because it has side effects that include thinning of the skin, irritation, and discoloration. High-potency steroids may help patients who don't respond to low-potency steroids. Immunosuppressants are prescription medications that prevent the immune system from overreacting. This prevents flare-ups of eczema. Side effects include increased risk of developing cancer, high blood pressure, and kidney disease. Other treatments include light therapy, lifestyle changes to reduce stress, and alternative treatments that include acupuncture and tea therapies. There are treatments to alleviate the symptoms of eczema, but there is no cure for the condition. Children with atopic eczema may often grow out of it as they age. Several new therapies are being tried that may severely affect the quality of life in an individual. As the condition is often related to family history and personal history of allergies, genes may be associated with eczema. Gene therapy of genetic engineering is a new avenue of research in eczema. This topic relates to the IB2 Objective 11.1.2, outline the principle of challenge and response, clonal selection, and memory cells as the basis of immunity, as well as the Objective 11.1.3, define active and passive immunity.